Well, it starts as a bump on your hand and it can make it so you can't open them all together. It's actually a common genetic condition that may affect millions. Plastic surgeon Dr. Michael Kim is joining me this morning to talk about what exactly can be done about all this. Good morning, Dr. Kim. Thanks for coming in.
Thank you.
So first of all, we're talking about dupuytren. What exactly happens if you have this?
So dupuytren's is actually described by Dr. Dupuytren, who was Napoleon's doctor who treated his hemorrhoids. But this is long ago. But anyway, it's a disease of the fascia. We don't know exactly why, but the fascia thickens. So it could happen in the feet, the hand, even the penis, and it causes the tissues actually to harden and contract and get thick. And what happens over time is you can see this fascia in the hand, which is very superficial, the little band, or we call it a cord, that slowly pulls the finger in and starts becoming debilitating. And usually after about 30 to 45 degrees of contracture, patients come in saying that, they're having a hard time opening their hand, doing certain activities. The finger sticks to their eye when they're putting their hand up in their hair. So it's something that's pretty common. I would say almost 5% of the population has a variant of dupuytren's.
Oh, really? And if it goes untreated, what can happen then?
Well, the progression is indeterminate, so some people might get a little lump and never gets worse. As you can see on the bottom upper left, the little lump that starts. So a lot of people come to my office and they have no idea what it is. They think it's a tumor and they come in, it's a little lump. And in fact, it's just dupuytren. So I reassure them that they may never get worse, nothing needs to be done, etc. Over time, the progression increases, we don't know why, where the finger starts contracting, the cord gets thicker, and eventually starts bending down, and it starts affects your activities of daily living.
And treatments that are available, or are there any?
So next slide, so there's main 3 treatments. One is the surgery, which we cut the cord out, but because it's genetic, it has a propensity to come back. The recurrence after surgery is about 20%. Okay. The second is a needle polymerotomy, where you take a little needle and you actually divide this cord and you stretch the finger out, and it works pretty well too under local anesthesia, almost no downtime, but the recurrence rate is much higher, probably 50% in a couple of years. And then the newest treatment in the last couple of years is Xiaflex, which I've done, which is a little bit more expensive, basically injecting an enzyme and dissolves the cord, and then you pop it the next day, which is a little bit violent, causes some swelling. And it has a little bit lower recurrence than needle polymerotomy, but probably a little bit higher than surgery. You're talking about 20 to 30% recurrence rate after 3 to 5 years.
If somebody sees this and they say, you know what, I've got a little bit of a bump, but I'm not having too much restriction right now, what would you recommend they do? We have about 30 seconds left.
Well, I think you should probably be evaluated by a hand surgeon just to make sure that's what it is, because there are some tumors that can mimic this. Once it's checked out, unless it's dupuytren's, just observation, unless it hurts or impairs function, and then treatment's necessary.
All right, Dr. Kim, thanks so much for joining us.